Talk to me about how you prescribe the home exercises. What does that actually look like? Because I feel like that is such a huge sticky point that you can deliver to them. What does that look like inside of Virtual Health 360?
Okay, great question. So we try to get our PTs to be as niche as possible and to know who they're serving as best as they can. But our number one PT that we see inside our organization today is somebody who's about 3 years out of school and is frustrated. So they don't necessarily have a ton of niche specifics. They don't necessarily have a lot of clinical experience. They're kind of like where I was when I started the business. It was just like, I don't know, I like orthopedics, right? And so we do have some clinical excellence programs and some places where they can ask questions and things like that. And there's a ton of education of like how to build out programming, recommendations, HEP, like how to not over address your patient's injuries. Because the number one issue that I see in virtual today is the PT's like, well, I'm not in person, so I better deliver a whole bunch then. Let me give them 18 exercises, right? And then they like way overload this individual. They flare them up. And in reality, like, let's keep a real simple program. So we do educate a ton of that inside our course modules to teach individuals. But it's something that most PTs take 4, 5, 6 months to get good at. I look at the whole first year that I treated and I'm like, dude, what were you doing in the virtual space? Like I was a mess, right? Like I was not good at it.
It's the True Sports Physical Therapy Podcast. Tune in. You might just learn something. Catch all of the full episodes on all streaming platforms. And as always, the link is in the bio.